This is NTV.
Now tonight, Kenya enters the most crucial week in the fight to control the spread of the coronavirus. In just 12 days, 25 patients have been confirmed positive, and we are still counting. But the rest of the world continues to take measures. In the United Kingdom, India and South Africa, those being the latest country to take radical measures. Now Kenya is steering at that reality, and many have argued that this is the surest way of checking the spread or more to people, and of course people continue to drop to hospitals to get checked as others go into compulsory quarantine. In other places, the residents have had to take the law into their own hands after candidates for the virus refuse to self-quarantine. Now these are extraordinary times indeed. Tonight we take a look at the steps the government is taking and continues to take. We address the effectiveness of those steps and look at the gaps. The phone lines will also be open for you to contribute to the discussion tonight. Later, the cartoon of the week, Who Said What, and Back in Time, On Time Bar.
This is Sidebar with Ken Mijungu.
But first, it's my take tonight, and we take this opportunity to dedicate this time to reiterate why it is important to heed advices, directives, and set protocols if we have to win this war. Now, tomorrow, Wednesday, the government will make an announcement as additional measures are put in place. This morning, a friend called me to ask me if the media could intervene in a case where the landlord is allegedly to have violated a tenant's rights. Now, what happened is this. He told me that individual who had returned to the country a few days ago from the United States had refused to self-isolate. He continued to roam the streets and, of course, the estate. And after several ignored advices to self-isolate for 14 days, he was forced back into his house and locked from outside by the landlord and the residents. Now, such are the steps that have to be taken to keep everyone safe. This war will be won when everybody decides to come on board and, of course, play ball. In 12 days, our numbers have doubled. And as it looks, we may have even more infections. The reason the government is emphasizing on staying away from crowded places is because that is how China got it right. Every country that has successfully check the spread has adhered to the set out protocols. The UK, the US, Spain, Italy, which got it wrong at the beginning. And that's where Kenya might be headed. If we could just pay attention for 2 weeks, we will save months of imminent lockdown. In 2 days, 10 additional cases have been reported. If this was to happen in the next 5 days alone, we will be looking at more than 50 new infections. As CS Mutai Kagwe said this afternoon, this is that one time that you saidia, not say serikali saidia. What the government is asking is basic. Stay home, save yourself from you, wash your hands. Personal hygiene is paramount. Sanitize your hands every so often and minimize or stop personal contact with other people. It's also essential that you keep your children at home and cut off unnecessary visits. In fact, if you stay at your own home, you'll not have to visit anyone. Lastly, it's immoral to take advantage of your fellow Kenyans by overcharging them for essential services and goods, noting that everyone is just attempting to get by. And tonight, we borrow our quote from Marlon Brando. He's an American actor, was an American actor and film director with a career spanning 60 years. He said this: "If we are not our brother's keepers, at least let us not be his executioner." My guest tonight, Professor Matilu Mwao, and of course we have Simiyu Werunga, and we have Dr. Joseph Mugashia. They join me in studio. At Ken Mijungu on Twitter, Instagram, and Facebook. Welcome to our program tonight. Join the conversation as always. The hashtag is Sidebar. Use it for this conversation, and we begin the show right now.
This disease is not a joke.
Kiwa kuna ugonjwa wa kuambukizana, aliyeko ndani ya mji ule asitoke na aliyeko nje asiingie.
Go home. Stay at home.
They must consider giving families food rations that will help
Even a border rider, if he's told now you have to stay home, there must be bread on his table.
The government will take the severest action against any individual who knowingly breach these laid down conventions and procedures and in turn put the rest of the population at risk.
Right, and the top trending tonight, obviously it's about the lockdown, Italy, Africa, Germany, Kenya, and everything to do with COVID-19. Of course, we begin our discussion tonight with joining Simiyu Werunga. He's a security consultant based in Geneva, but he was based right here in the country and understands this country like the back of his hands. Good to see you, Simiyu. And let's begin by talking about a possible announcement that could be made tomorrow, because the government, even if you looked at the body language of CS Mutahi Kagwe today, the government is really angry that Kenyans are not listening. So let me begin with that. Explain to us what a lockdown would possibly mean for this country, Simiyu.
Thank you, Ken Mijungu, and sorry for what we are going through. I'm in Geneva, Switzerland. We are also experiencing a serious lockdown, and unfortunately, people all over the world, some people don't understand what a lockdown is until it is enforced by the law. Now, let me be very structured in what I want to explain. There are two types of lockdowns at any time when this scenario is put in place. One, we call it preventive lockdown, and then there's a second one that we call an emergency lockdown. Now, when you have preventive and emergency, the system in place can decide whether they want to make it a partial lockdown or a complete lockdown. Now, what is a preventive lockdown? Preventive means something has happened that is disseminating the population and the people of a country, of a place. And the system or the authority in place must come up with mitigating factors that must ensure that the risks that are being prevailed by this emerging problem does not decimate the people of that country. So there are many ways that the government comes up, and it's within the law. One, it is to ensure that the scenario does not develop to a point where people will lose their lives, medical systems will be overwhelmed, and where a country becomes hopeless. Number two, it is done to avoid danger and risks to the people of that country. And number three, it is done to mitigate the risks that are already in place so that the government can put in systems and mechanisms to deal with the problem.
Okay.
So this is the thing that we are seeing in Kenya today and all over the world.
Okay.
We are dealing with a preemptive lockdown that is partial in nature, not complete. It's partial in nature because certain systems and things must continue happening and taking place because people must live.
All right. And those things that will have to continue are essential services. Now, we have
essential services.
Yes. The United Kingdom.
Medical systems.
Medical.
Shopping places.
Okay.
Transport. And of course, people must have outlets to buy their food. And if there's any emergency, then people should be able to travel to the nearest medical center that can give them the remedies they are looking for. So those are some of the things under a partial lockdown that must continue because people will continue to survive and live, but it must be done under a structured framework.
All right. Structured framework. We have seen several countries do this. Just this evening, we had the announcement that India is doing it. We had South Africa. We know Italy has done it. Spain. Have Kenyans really grasped the magnitude of closing down a country partially, albeit partially, just because they are not listening to the government? Have they? Do you think they've grasped that?
You know, when you're dealing with an emergency, Mijungu, it's up to the government because this is a government procedure. If it is done in a localized scenario, for example, if it's a school, whether it is a university or it is a compound, that is different. This is a national partial lockdown. And the law allows the government to enforce what it is doing. That's why the minister, I think, declared under the Ministry of Health something acts that gives them the powers to ensure that what the government is saying has to be done. And let me tell Kenyans, It is the government's responsibility, and I never speak for the government, but we need to speak this. It is the government's duty and one of its cardinal roles to ensure the safety and security of the people of Kenya. Now, I've heard people, because we listen through YouTube, some of the things we are hearing people saying, it is up to the government to decide, do they want to enforce the law or they want to play around with Kenyans? If Kenyans are not behaving well, if Kenyans are not respecting the law and the instructions that are being given, it is the business and the responsibility of the government of Kenya to enforce. And this, as I understand it, under preventive and emergency scenarios, it is not something that you discuss, because your right to go to town should not infringe on my right to stay at home. Because when you go to town and you come back with coronavirus in our estate, you have infringed on my personal right. So I think it is incumbent upon the government to ensure that whatever they put in place must be enforced. Let me give you an example. In Geneva right now, we've been told you can't be more than 2 people. And the police are everywhere, Mijungu. So anytime you are found more than 2 people, instant fine of 100 francs, which is 10,000 Kenya shillings. And that is how people are now behaving. So it's not about asking Kenyans, pleading with Kenyans. This is the responsibility of the government of Kenya. They must ensure. Yes, we're here. Let me speak. I know I'm speaking too much. People are saying, but we have Juakali people, but we have people in the informal settlements. Unfortunately, this is a national emergency that is global in nature, and the government must enforce what it needs to do. The rest of the details, which we know people have hand to mouth to eat, which is very common in the third world, I think that one can be dealt with later. But you must deal with what is here and then discuss what needs to be done.
Very interesting indeed. And Simiyu, perhaps before I let you go, perhaps I'll have a few minutes with you. One of the proposals that has been given is to ensure that no one comes in and no one gets out of the country. In your view, if this was enforced earlier, do you think we could be at a different place right now?
Not really, because what we see even in Italy is our neighbor down here. They came up with certain scenarios before we did ours. Unfortunately, Kenya is a hub. So most of the travelers, most of the airlines, and most of the business people usually use Jomo Kenyatta International Airport. Yes, if it had been done earlier, probably the scenario would be different. But you see, we also need to agree that as a country, we have a very indisciplined population. Sorry to use that word, extremely indisciplined. And if you have people who don't respect the law, if you have people who don't want to quarantine themselves, and it has been made it very clear that please go home for 14 days, we don't want to enforce it through the law, and people misbehave. So I think at the end of the day, Ken Mijungu, it's about us Kenyans. How do we want to deal with our problems, and how do we respect what needs to be done?
Okay. I don't know why you're sorry for using that word. This afternoon, the cabinet secretary in charge of health actually used that word, Simiyu, if you must know. Yes. I like to read a tweet here that is attributed to him, and I want to believe this is his official account. Italy, 7,000 died in 50 days. Iran, 2,000 died in 15 days, thanks to revelers ignoring state warnings. Developed USA stressing over exhausted healthcare. I'll say it again. In capital, be disciplined and stop courting disaster. Our lives are no more meaningful than the 18,000 the world has lost to corona.
Very true, very true. And I also read somewhere where, because we follow our country, what is happening. I read somewhere where Matatu owners or something were saying we can't do the 8 people, we are losing money. These are critical times that require critical solutions. This is an emergency that has been declared a global pandemic. It is not about making profits, and I'm urging the Kenya government, Mijungu, to use the law that has been put in place to deal with emergencies and calamities. That, because if you are dealing with a population that is not willing to follow the law, is not willing to live under the rule of law, then you must enforce the law. What I'm seeing, probably the weakest link between the ministry, the government, and the rest, could be the law enforcement officers. How do we deal with them so that they ensure when a matatu has been told to have 8 or 15 or 25, what I was reading, needs to be done. Mijungu, we must have a disciplined society. But because we know we are not, then it is up to the government to enforce the law without mercy. That is the only way we are going to stop this corona. We shall deal with the fewer numbers and ensure that the rest of the Kenyan people are healthy and go back to work.
Okay. I have a doctor and I have a professor here, both medics, and I'm going to be speaking to them. But this is a question that I cannot ask them, Simiyu. How do you balance, as a policymaker, how do you balance the interest of people to survive and their right to survive against the interest to protect them against such pandemics?
You know, Ken, I come from a security background and I've been in this field for long. We normally say for you to eat, you must secure yourself. For you to plant or to do farming, the area must be secure for you to do farming. For you to be safe in your house, the environment must be secure. So these are difficult times that the government needs to deal it in a difficult way. Secure the country first, then the rest will be done. Many countries that have the capacity to put in resources to mitigate Kenyans are people who are not able to earn, are putting in money so that the people are paid even as they're at home.
Okay.
I'll urge the government, if there's any way they can go about it. I know it's going to be very difficult. Kenya is my country, all of us know it. But if there's any way they can mitigate this in terms of ensuring that the people can be assisted to survive, that will be done. But I think the cardinal role and responsibility now is to ensure that we are all safe, we are healthy, and people obey the law.
Okay. And finally, to those Kenyans who still think this is a joke, what do you tell them?
Arrest them. The law is very clear under the Emergency Act. Arrest them, charge them, let them go through the process, and they must follow the law, because the law is very clear. When you declare an emergency, there are punitive measures that need to be taken. Okay. If you violate what the government has said under an Emergency Act, there are rules and procedures that must be taken, and those who violate are violating the law. So that is how it's supposed to be done.
All right. Thank you very much, Simiyu Werunga, speaking to us from Geneva, a security consultant and who is a regular in our program. Thanks for sharing your perspective. We might just want to keep you a little longer for our Q&A, but let me bring Dr. Joseph and, of course, Professor Matilu now to this discussion. We have about 3 minutes before we take a break, but just listening to what Simiyu Werunga is saying, this is something that we have to now start listening if we haven't been listening.
Yes, and one of the things that you also need to understand is that many people in places outside of the big cities do not have the same amount of information about coronavirus as you do. So the decisions they make are not as informed as the decisions that, but I agree with the consultant that there's a lot of indiscipline in this country, but I also rather like the approach the government has taken so far, although I actually suspect that they are going to be much more firm, seeing the effects of what they have tried are not as satisfactory as they had wanted.
Okay, Professor Daktari, just commenting to what Simiyu has shared with us this evening.
Thank you very much, Ken. I would like to agree with the issues that Werunga has talked about. This is a disaster. It is a disaster of unimaginable proportions. And what we are seeing is that if we don't take care, if we don't heed the government's guidelines, we are going to get into a complete lockdown. 2, we are going to get into a situation where we simply cannot control this disease. And I would like to urge Kenyans, wherever you are, you don't play around with viruses. Viruses are not bacteria. You don't see them, you don't easily get them even in the medical tests, and these are enemies that are very, very pathogenic or infective. So we need to take that route of very, very severe enforcement of the guidelines.
Okay.
But however, I would also like to point out that the pandemic responses are normally scaled. So we are in a phase 2 situation where we have disease in the country. We want to prevent to go to the third phase, which is pockets of community infection. If we get there, then you get a complete lockdown. So Kenyans, it is important that we listen and we be disciplined and we follow the guidelines that we have been given. Thank you.
All right, we're taking a short break now, but when we come back, I'd like to speak to the two doctors, because now that the government is heading to the next phase of this, and as Mutahi Kagwe put it, tomorrow there will be a grand announcement, or rather we are interpreting that it could be a grand announcement. We still don't know what it is, but I want to talk specifically to the next frontier in the fight against this virus. And you, Dr. having worked in several areas, including 2007, response and preparedness, I'd like to get a perspective from you what exactly the next few days in this country is going to be like. And remember last week during the press conference, the CS said that the next week or so is very crucial for this country. Before then we get to that discussion, let's take a short break. We'll be back with Sidebar.
Automated parking system, you can now pay for parking in 3 stress-free ways. Using M-Pesa through the USSD code *486*12#, or using cash at the CAPS payment points located in the parkings, or using your preloaded CAPS A card. No payment will be done at the exits.
Now more than ever, you need to be abreast with the daily happenings wherever you are. Get the Daily Nation e-paper with a free COVID-19 newsletter at a special highly discounted rate of Kenya shillings 500 for a period of 1 month. Daily Nation. News anytime, anywhere.
This is Fact Finder from the BBC. More Africans are going online, but how do they access information with low speeds and internet shutdowns? A Kenyan MP wants to police Facebook and WhatsApp groups due to offensive content online. So, is your phone listening to you? Myth or fact? We'll find out.
Rib-cracking comedy. Just move to NTV.
This is Sidebar.
We are suffering from cases of indiscipline, and Kenyans are exhibiting a very indisciplined behavior, and this is going to cost us. We want responsibility among citizens. If we tell people to do things and they don't do them, if we tell you that a matatu should have 8 people and then you do it when you are being watched by the police, and then when you leave the police, you go and start doing it, you go back to normal. It is unfathomable. It is difficult to understand what you are trying to do.
Right, and today the body language of the CS actually betrayed him, because for the first time he looked really agitated and serious about this. My guests are still here: Simiyu Werunga from Geneva, Dr. Joseph Mugashia, and Professor Matilo Mwaudhi join me in studio. I'll be asking a question to you, Simiyu, in a short while, but this is a question that has been brought up by one of our viewers, and I'd like you both to weigh in on this. Is it possible, Prof, to start with you, is it possible to be reinfected after you are healed?
Actually, the evidence that is now becoming available is that several people who got infected and got healed have got reinfected. So this is somewhat disturbing for us, because for several viruses, we know that when you get exposed to that particular virus, you develop immunity, and when it comes back, it finds you are ready for it. In this situation, people are getting reinfected. This is a curious thing for us as researchers, and I'm sure in a short period we will know the answer why this is happening.
Okay, Dr.
The virus, the coronaviruses are not new viruses to the world. They are viruses that have been there. But this particular one is a new strain that the human body does not understand. It has not infected the human body before. And we don't know a lot about this virus. We are learning as we try to stem the pandemic. Therefore, as research is being done, we'll be able to know how long it takes for somebody to remain protected after infection. So we still have a lot of information that we don't have on this virus. But I agree with the professor that research so far shows that once you get infected, you can be reinfected.
Okay. The other thing that we have had, perhaps you need to clear the air on, is the fact that this, if you have a strong immunity, you can actually contract the coronavirus without necessarily showing the symptoms, and you get through it without even realizing that you had the coronavirus. Is it true, Prof?
I'm not sure whether that is the explanation. Maybe we should start the other way around.
Okay.
A majority of the people who contract coronavirus will have mild symptoms, and they might not even suspect they have coronavirus. That one probably has many explanations, and one of them could be the immune situation or the immune condition of the person, the general state of health of the person. But there are many people who will contract and become very sick. And this is where our problem is. And also the fact that when you have coronavirus and you don't feel sick, you're actually transmitting it to other people.
Without knowing.
This is a problem, a major problem. Yep, without knowing.
Without knowing, Dr.
Yeah, we also need to also appreciate that we are getting infected all the time by pathogens, some of which we don't even know. And we have some innate immunity against some viruses. But for this particular virus, it is having a very wide spectrum of expression, where you have those people who are infected and they are not able to, the virus is not able to establish. Those are the people that are being said to be, they can be immune. But it's a very small proportion of the population.
You might not even realize it.
Yeah, okay. Because when you look at the infection rates in our population, what the scientists we are estimating, it's about 80% of the population that will get infected. You have that
80%.
80%, and that means that it's almost the whole population. So we know there is a possibility that you may get the coronavirus. You don't show the symptoms, but you are transmitting.
But you are transmitting to the reason
others are mild. Sorry, okay. Others are mild, and others, as Professor says, are very, very sick, and others actually die. So it is a virus that we can't afford to joke around with. Okay. We have to be serious.
The reason why I'm asking this is because Italy, the doctor Dan Mwangi spoke to, said during the first attack of this virus, they thought it's a regular normal flu that hits the country at that duration, so it was ignored. How likely is that in such an environment, Prof?
One of the, okay, it's a macabre thing to say, but one of the advantages we have is that we saw what happened in other countries. So if you look at Kenya's, the way the health system and the government have taken this matter up, they learned the lessons from other countries. Otherwise, if it had happened to us first, we would have taken quite a bit of time before asking ourselves, why are people so sick in hospital? Remember that we didn't really they initially in other countries, they didn't really have a diagnosis. And they would see people very sick, they have a flu-like thing, and then they die. Even for Kenya, if you hadn't learned lessons from other countries, would have gone through this phase before it took action.
Okay.
Yeah.
Okay. Simeo, perhaps the last question for you is, before this lockdown, there are a lot of measures that, for example, you've seen happen or taken in Geneva. A lot of Kenyans are concerned about their daily sustenance. You know, people live here from hand to mouth. Perhaps drawing from the lessons from Geneva, what measures exactly would you perhaps want to see the government put in place before we could go to a total lockdown of this country?
I think one, Professor and the doctor there, I'm not sure whether we are ever going to get into a total lockdown. Complete lockdown is not possible because certain things must continue happening. I'll be very, very honest to tell you that I don't see what the government can do. I know they might come up with something to say, for example, in this country, before they even locked us down and told us don't move, go and buy medicine only, there was a continuous public awareness campaign to make people understand the rigors of this virus, to make people understand how it can be very difficult for the government, even if they wanted to save you, if you don't take care of yourself. So there was a serious campaign for the people to know that this is exactly what is going to happen if you don't play your role to assist the government to do what it needs to do. Now in Kenya, in terms of how the Kenyan people, our colleagues and Kenyans can be taken care of, I know it's going to be very difficult. Why? Two things. One, in Europe, and I'm not saying this because I live here, I mean, in Europe they have systems that work. They have data that is very correct. They have procedures that have already been tested and they work. So when they want to do something, they know exactly where to go, they know who to look for, and they know how it will be done. In Kenya, I'm not very sure whether we know how many people live in Mukuru, for example. We don't know how many people go to Mukuru every day and leave the following day. We don't have mechanisms to know how many they are. We don't even know how the road system or movement system, for example, in Mukuru is. So there are many, many mitigating factors that will make it near to impossible for the government, even if they wanted to assist the people, to do it. So one thing I know, even if they want to do something, and this is a very realistic view from my point, they must come up with mechanisms that first will give them the ability to know what they are dealing with. How many people they are dealing with, how is it going to be done, what are the logistical imperatives that need to be put in place for the government to assist. Those, in my view, Ken, they do not exist in Kenya. We've seen it even when we have famine all over the country, and therefore I have no idea. Maybe that's a question that policymakers can answer you. Planners in the means of the treasury and the means of planning can answer you. But I think from where I stand, even if the government wanted to do something serious now, it might take a while before the rubber hits the road. It might take a while. So I don't know exactly how they can do it, even if they wanted to do it. And if they want to do it like tomorrow, Ken, I can promise you, it will be so jumbled that it will have no effect for which they want it to achieve. That is my view.
Okay. Finally, Simiu, as I let you go, what you're saying is true. We have seen what has happened at the airport, the chaos that have been witnessed in the last few days. But perhaps talk to, in about a minute, talk to the people who are thinking the solution is going to the village from Nairobi. Talk to that group of people.
One, like a professor said, I don't know whether it's doctor or professor, a virus, you don't see it. You moving to the village does not stop you from getting this thing. And I also had one of your colleagues saying community spread. I'm not sure whether the person was sure what he was talking about, because community spread is not getting it from somebody who came from outside. That my understanding is different. I could be wrong. Community spread is having this thing and you had no contact with anybody. It just happened that you have it and you start spreading it. So what we are seeing in Kenya, we hear people are now moving to the villages, and some of them have not even been tested, they have not even been screened. So what they are doing is essentially transporting, if they have, what they have to the village. And we know the Kenyan context is that villages have poor services. It's better to be in towns or areas of urban centers where some systems are functional and it's easy to get to a medical center than transporting this thing to the village. What Kenyans are doing, unfortunately, some of them have this thing, they are taking it to places where the systems that can mitigate these problems are very scarce. I'll urge them to stay where they are. I know there's an issue of food and how to survive. If they go to the village, then let them go to the village and quarantine themselves the way we've been told you take 14 days. Okay. After which, then they can visit and call that number we've been seeing on YouTube, where the Minister of Health can check what is happening on them. But just going to the village and you're not taking any precautions, you could be transferring this problem to your whole family. No. My urge is follow the procedure that is there even if you go to the village, and ensure that you follow the mitigating factors and procedures that the government has put in place.
Okay. Thank you, Simiu Werunga, speaking to us from Geneva. Of course, I'm in studio now with Prof and Daktari here to talk about this. Make us understand, Prof, what he was talking about community spread. What is that?
So first of all, you must realize that this virus is not a spontaneous thing that just happens. Somebody must bring it to the community.
Okay.
Somebody must bring it to the community. And this is the problem with coming from the airport and going to a rural area. You're going to take it there. It's also the problem with coming from Nairobi or from Ongatrongai right now and going to a rural area. You feel okay, you feel healthy, you feel you don't have the virus, you feel you've not touched anything, you've not come in contact with somebody. That could be true, but it could also be wrong. The moment you take it to a rural area, because you feel okay, you don't behave as though you are sick and you don't quarantine yourself
don't
and
take
so
precautions.
On. And then now you put other people in a lot of trouble.
Okay.
This virus kills and you are going to take death to your village. Don't do that.
Very unfortunate, but very strong statement, which is laced by total truth. Is it possible, Daktari, that if the government measures were to be put in place and practiced to the book, they'll be able to check the spread of this virus?
Okay, now, before we can answer that question comprehensively, we must look at the phases of response to a pandemic.
Okay.
You normally have 5 phases when you are responding to a pandemic. And the first phase is where the pandemic is declared and you do not have a case within the country. During that time, that is the phase 1. During that time, your business is to mobilize your pandemic preparedness plan. Normally, there is always a template that you work with. And you modify that template to fit exactly what the pandemic is all about. Now, the idea there is to keep the disease out of the country. And I would like to commend the government for what they did in that first phase. Yes. Then you have the second phase, which is the first case, the index case, or what you're calling patient 0.
Yes.
Now, in that situation, you have the disease in the country. And what you want to do now is to implement the pandemic response directly to an affront by the disease. That's the disease in the country. Now, that is basically where we are now. And the government is trying to tell the citizens, please, we need to mop out all the cases and go back to phase 1, where we had no cases. Now, at this point, the government has looked at the nature of the spread of the disease. And most of the cases that have come in, majority of them have been introduced from outside. That we call it the disease pressure from outside. And from what we have seen with the other countries, then it is good to close all the borders and be in the country with the disease that is already there, try to look for it and exterminate it from the society. Now, if we are not able to do that, if we continue with the same trend where people are not caring about this and where people are not really understanding the nature of prevention, then we go into phase 3, where we have pockets of community spread of the disease. That is a situation where, for instance, you have disease in Mukuru, you have in Kawangware, you have in Githurai, you have in Runda, but you don't have disease everywhere. Now, at that point, a total shutdown, a total lockdown is necessary.
Okay.
Because if you have it in different counties, then you have no other way of dealing with it. Now, If we are unable to deal with that, we will go to the fourth phase, which is community transmission. That is now, the disease is everywhere. And it is actually overwhelming.
That's where Italy is. I would say that's where Italy is currently.
At that point, that is where, going back a bit, in phase 2 and 3, you have a lot of involvement of the security agents, that is minus the military. And you also have involvement of all the ministries that are concerned with supplies to the citizens. Then if you go to the fourth phase, the fourth phase, where now Italy is, you don't have any choice. You have to bring in the military in full force. And you get a complete shutdown of everything. Okay. And even movement is very difficult. And we are working, the government is working and asking the people to work with it to ensure that we don't move beyond phase 2.
Okay.
Now the final phase, at the fourth phase, if you do not control it, the disease runs its normal course, natural course, and those people who are dying will die. And it is good that people hear this. At that point, you have given up and you let the disease take its course. From there,
because you can't even manage it.
You can't manage it. You have to put even things like field hospitals, maybe in schools, maybe in playgrounds, everywhere. And that is where you even have to bring in the military. And then the disease, after some time, will infect the majority of the population. And those who are recovering will recover. Those who are dying will die. And then the disease will die out. And you move to phase 5, where you have to do now reconstruction and recovery. It is a very painful experience if you go all the way up to phase 5. And that is why I can see the emotion in the CS. Because definitely he has been briefed and he knows now what will happen eventually. Okay. So I talk about this as a pandemic response planner, and this is something that we went through a lot with avian influenza pandemic, the threat, and fortunately avian influenza was not as transmissible as COVID-19.
Okay. Very disheartening, Prof. Very disheartening, but this is the naked truth, as I may put it.
My own take is that it's probably very difficult or very ambitious to stop this disease right now. It's very ambitious. More likely, with significant effort, you could slow down the transmission so dramatically that it remains something manageable, okay? So that doesn't become a public health disaster. And the reason why you want to slow down for instance, reduce new infections is because it can give you a chance to get your health sector sorted out so that those ones who are getting infected, very few people, the health sector is able to take care of them, so that you can get testing in place, get screening in place for a majority of the people who require that without stressing the system, right? So, and that's where now in fact, I rather like the CS. I sat in a meeting with him and I saw his vision and I was very impressed actually. He's probably thinking of a situation where he can reduce the infections, new infections so dramatically that we are like where we are right now and not, the growth, not the disease growing exponentially. Slowing it down will also give scientists a chance to develop, or will make manufacturers, give them a chance to make vaccines available. And I know people are working very hard towards that. And also treatments that work, that are well accepted, to become available. Because we suspect at this moment that coronavirus may be with us for a while. And if it continues making people sick and making people stay at home, you can imagine the devastation of the society. So it would be really nice if a vaccine becomes available or treatments that work. For them to be useful, you shouldn't go to the phase 5 that Dr. Aria is saying. Otherwise now you'll find the whole population has been decimated by death, destroyed, and then when you come with the vaccines and so on,
it's useless.
They're more or less useless.
All right. For the first time, we are doing phone calls on Sidebar tonight. We want to hear your concerns, and there are a lot of questions that you have raised regarding this, especially your concerns about reinfections, fast infections, community spread, all these things that I don't understand. So if you have them, the phone lines are on your screen. We'll be taking them in the next hour, so just keep them on your phones and start calling after the few minutes that we have here. You wanted to say something?
Yeah, Sorry. I wanted to say that really, we don't have to go all the way to phase 4.
But it's a reality, Daktari. We don't have to, but it's a reality.
Yeah, it is a reality. Yes, we could get there. But if we have very, very concerted efforts, there is a chance that we will be able to retard the movement, the spread of the disease. Yeah.
This is what he's talking about, the flattening the graph. The curve. Yes. That's what you're talking about. How comes, Prof, we don't understand this? How technical is it, as a researcher, how technical is it to understand that indeed this single pandemic could wipe out the whole country?
I don't think it could wipe out the country in terms of humans. Humans have gone through a lot of things in the past and survived, but could destroy our economy to a point where in our lifetime you and I will not have recovered sufficiently to enjoy the benefits of the economy that we see now. It can make very many people sick and can kill thousands of people. Now, you can imagine a country like Italy right now with thousands of dead people. It's a rich country, and you can see when you listen to like the people in positions of authority talking about it and the stresses that their country is going through. This is not something we need here. This is something that we can escape if we just get our acts together. The amount of indiscipline I've seen, even today, like in the marketplaces and so on, people don't even care completely about this thing. They don't care. I mean, maybe they care, but they are doing nothing about it. They don't show it. Okay. And so you look at the marketplace and you see hundreds of people, and you ask yourself, if there are just 2 infected people in this group, what will happen 5.1 days from now? It's a big issue.
Very interesting. What would happen? Because look at the first patient 0 came into the country on the 12th. 13th, the first case is announced, right? And in 12 days, we have doubled the numbers. I don't know, from your research, from your knowledge, is there a country that has seen that kind of growth in just mere 12 days?
That's what the countries are getting.
Yes.
And
it's
data shows,
replicated all over. Okay.
You see, you need to go back and look at the ineffective nature of the disease. Every infected person is being estimated to be infecting about 4 people. So if you look at 1 person infects 4 people, then it means the other 4 people will infect 16 people.
Yes.
So it moves very quickly. Now, but there is something that we need to bring forward in terms of the figures that people are seeing. This disease, the biggest problem with it is that it is very highly infectious. So it takes, if it is allowed to run its course, then it will infect almost everybody. Now, when you do that, you have heard of things like case mortality. That is the number of people who are dying out of the infected. These are about, is estimated by WHO to be about 4%. Now, when you talk about 4% of people infected, of people infected dying, you are saying that these are very high absolute numbers. These are too many dead people. And that is one of the reasons why the disease is, so scary. Now, the other thing is the issue of the socio-economic disruption. Because of this fear, and also because of the stoppages, a lot of people are not going to be able to earn their living. And when that happens, you also have other spillover effects, like increased crime. You have a very high rate of crime. Already we saw one of the documentaries by Dennis Okari, which was talking about somebody who is selling liquor to school children. And I watched it and it was scary. There is another one who was selling marijuana, that is bank. And it was there, it was captured. So those are crimes that are coming in because of the lockdown or the partial lockdown. So what we need, again, is to have very serious enforcement where the civilian security forces, that is the police and other organizations, they need to be extremely vigilant in following up, one, the enforcement, and two, the detection and curbing of crime, because that is going to go up, and it's one of the things that we prepare for whenever we are doing pandemic preparedness. It is an offshoot of the pandemic or the disaster.
There's something people have not thought about that they should be aware of, because most people are probably thinking, oh, I might catch this thing, I'm strong, I'm okay, and then I'll get a mild infection, I will even need to go to hospital, and I'll recover, and I'll become immune. First of all, some people will not become immune to this thing. The second thing, which is equally important, is this. There's some evidence coming through that for some people who have recovered, they have ended up with permanent lung damage, permanent liver damage. There's some evidence coming through. And you should ask yourself, if I catch this disease, am I one of those who will become debilitated going forward? So it's not something that, as Dr. here says, first of all, it's very infectious. There are some other diseases like Ebola, for instance, which are very scary because of the dramatic nature of the symptoms, but they are not nearly as infectious as this coronavirus. So people need to be aware of this kind of thing.
Right, very interesting. The conversation continues after this short break, but the phone lines are open in the next hour. If you have any question to the experts right here, you can call in and ask. Also, the hashtag on Twitter is sidebar. Use it. If I see your questions, I'll be able to ask them. First, we take a short break. But even as we take the break, Jackson, perhaps you could just remind us of what was said about this disease starting in Italy through somebody.
Remember that the experience of Italy started exactly the way we are behaving. There is nothing that we have done that is not going to give us exactly the same experience if we exhibit exactly the same behavior.
Wherever you are, you can still stay updated daily. Get your favorite paper delivered to you. For home or office delivery, contact us on 0719 038 062 or email subscription@ke.nationmedia.com. Daily Nation, the truth.
The blind man told police officers, afade mimi sijawahi ona bangi maisha yangu yote.
Hizo ma award zikafanya watu waanze kuimbia award badala waimbe the word.
Mimi mkinichagua mtaona miujiza.
Anajifanya siku hizi.
Kibia mara moja.
Naogopa Mwenyezi Mungu na uji moto peke yake.
Hiyo si bangi.
East Africa is transforming. And so are we. We're now more diverse, more visual, more engaging. Grab a copy of the new East African. To subscribe, email subscription@ke.nationmedia.com or e-paper@ke.nationmedia.com.
This is Sidebar.
All right, gentlemen, welcome back. And we are taking your phone calls in just a bit, but I'd like to ask this to Prof. and Dr. right here. You work for Cambridge, you're a deputy director of Cambridge. Perhaps our viewer would like to know, for Kenya, what is the government, aside from taking these measures, what is our biggest research institute doing?
Thank you very much. First of all, you might have seen some news that we actually, I suspect we provided more sanitizers than just about anybody, because one of the most important things for this virus is to keep your hands clean, sanitized. Don't touch your face. I've touched my face today also, but I sanitize my hands with what we call Kemra, one of the Kemri products, all right? So, but Kemri is a research institution. And even before you get to research, there's something that the country has been wanting very quickly and very intently since last week, diagnosis. And you're now aware that many of the diagnoses of the coronavirus have been done in Kemri. And since we had this the first time, Kemri put its machinery in place so that we anticipate that we can probably test within Kemri we can provide more than 10,000 test results in one day in Kemri.
More than 10,000.
Yeah, you know that there just have been a few diagnoses made and just a few hundred tests done so far. But even if, God forbid, the situation got to a point where thousands of people required testing, Kemri would probably be able to do more than 10,000 tests in one day. And as we speak, Kemri has been procuring the reagents and putting the machinery in place so that this is one of the things that we'll be offering going forward. The other thing is Kemri is a research institution. We are looking at this virus. We want to understand it. So there are things that sometimes you may have heard of called like sequencing. We want to know how it looks like, how it behaves in our people. We know how it behaves in the West because they've done some research. We want to understand what we need to do to make vaccines for it.
Okay.
And you are aware that we have skills in vaccines development and we can make vaccines given enough time and when you understand the virus properly. And also, Kemri conducts clinical trials normally, has clinical trials infrastructure. If somebody out there has medicines that they think can work for this disease, Kemri can test them and check that they work. And even if they have vaccines, Kemri can run this kind of thing. So
Dr. I'm coming back because I need more explanation on that, but I need to take a phone call from Wilson, who is in Rongai. Wilson, what's your question and to who are you directing your question tonight? Wilson, good evening.
Yes, thank you very much. Good evening to you.
All right, I don't think we... Wilson, we can't hear Wilson at all.
I can hear you.
Yes, but we can't hear you in studio.
Yeah, I'm hearing you.
All right, now what's your question, Wilson?
My question is two of them.
Okay.
One of them is, today we got there are 25 more cases. In the previous pronouncements we have had, all the cases accounted for in terms of how they originated. But the 9 today were not explained. How would you be able to know exactly how the 9 came about? The second thing I want to ask is that now that we have been discussing about all this and you can see the health CS actively telling us and updating us, where is our disaster management programs? Thank you very much.
All right, those are two questions. Do we have another caller? All right, we'll be taking your calls, but I think those are questions to you, Prof.
Well, maybe I'm not an expert in the disaster management bit, although I'm a member of the National Task Force around coronavirus, and I do know some of the things that have been put in place. For instance, you know where to put people who are going into quarantine. People are not loitering in the streets, okay? If you come in, you know where you'll be taken, right? You know if you are sick, where you will go. Places have been put up for this kind of thing. With regard to the cases, of course, even the 9 cases, it's known where they were from and how they got, who they got into contact with, who infected them, and so on. It's only that perhaps that information, given the short period of time it takes for press conferences, sometimes that's not information that, but it's known. It's known. Yeah.
All right, Dr. On disaster.
I will deal with the disaster management.
Yes.
Once again, I will say I don't speak for the government, but I am able to see what the government is doing. Now, in disaster management, you normally will have a lead ministry that takes up an issue. Now, this is a public health issue, it's a medical issue, so it is headed by the Ministry of Health, and correctly so. The Ministry of Health is the one that coordinates at this level. But if the disease moves on, for instance, to the third phase, then they would start thinking about probably handing it over to a specialized organization like the Disaster Operations Center. However, as it is now, we need to realize that this is not just a health issue. it is a major disaster. And for that reason, the coordinating ministry needs to bring in the other ministries like agriculture, which deals with the food supply, trade, which deals with processed food supply, security, that is interior, that deals with security and enforcement of guidelines.
But they're already in that team headed by
they are
CS.
in there,
yes.
But they need to take a bigger role now, because already we are confining people, and you are seeing that there is flouting of the guidelines. So they need to be more vigilant and more participatory.
Okay.
In the whole of this.
All right. Let's take a phone call from John. John is calling us from Nyandarua. John, what is your good evening, and what is your question to any of our experts tonight?
Thank you, sir. I'm John Kinuvia from Olkalau. My question is, hello?
We can hear you, John. Proceed.
My question is, now that they have said that chloroquine or quinine can cure this virus. Excuse me? Hello?
Yes, we can hear you, John. Proceed.
Why don't they try to apply it among those who are sick? And maybe I am asking the guy from Kemley or the doctor with whom you are today, so they may explain to us if it's possible. Thank you, sir.
All right. Thanks, John. I think that's our question. Personally, I'm allergic to the queens. The queens.
Thank
so
you.
if it was supposed to be used...
and I think chloroquine has not really been used in this country for quite a bit of
yes,
time. Last time I checked,
yes,
because of other issues that were safety, that were related with its safety. But there is some evidence, a little evidence, that chloroquine with some other drugs work for this virus. Some evidence. But in medicine, we don't just take things at face value. For us to know whether this concoction of drugs works, we need to do a clinical trial so that we can understand whether they actually work and what the safety profiles are like. We haven't had enough time to do this kind of thing. So it is impossible, even for a government like Kenya, to just say, oh, just give people chloroquine and azithromycin. They may not work and they may harm people. We have to do clinical trials.
There has to be clinical trials. All right. I stopped you. We'll take other phone calls, but I stopped you when you were explaining to me the roles at Kemri, clinical trials. Perhaps just to give you a moment to breathe, let me ask him, let me ask Daktari. Daktari, we've heard what the government is doing. What would you, from where you sit, what would be appropriate at this particular point?
Okay. At this point, one of the things that we need is relooking at the disaster response. Now we stop looking at it as a pandemic response, but we look at it as a disaster with all the aspects of a major disaster. Now, this means we look at the coordination mechanism, first of all, the players in the disaster response, and we classify those people, those agencies. And each agency makes its plans of how to respond, all the way from the phase 2 we are in up to phase 5. Now, in this case, I'm thinking in order of importance. We have the Ministry of Health. Right now is the coordinating ministry, and rightly so, because it's a disaster of medical origin. We need to deal with the Ministry of Interior, which needs to come in strongly to keep law and order and also to enforce the guidelines that are being given. We then have the ministry, once people are confined, they need to eat, they need supplies. We need to see the Ministry of Agriculture coming in and telling us what are its plans for complementing the other agencies in responding to this disaster. Why do I say this? Because when you look at people in confinement, they need food. That is the Ministry of Agriculture, which is responsible for that. And we know that the Ministry of Agriculture for a long time has just been doing its regulatory role, but the coordination role in food production and distribution has been delegated to the private sector. In this time, they need to come in very strongly and guarantee us that once we have, for instance, a lockdown, or even in the partial lockdown, we will be able to get food that is safe and of quality and in the adequate supplies, quantities. Okay. Then you have the Ministry of Trade that needs to look at processed supplies. including foods and other non-food items. These ministries, in the whole of this, I'm seeing them absent. I hope they have plans, but they need to do those plans.
Okay. All right, and I'm glad today when I was coming to work, I could still say people had food and all that. Even as we wait for other phone calls, I'm just wondering if the measures that have been put in place until today, Professor, in your view, is sufficient?
I think in other jurisdictions they would probably be reasonably sufficient. I think they were put in good faith, and it's not just in Kenya where you have difficulties making people behave in a certain way. Even in Italy, which is a developed country, people don't behave as you expect. And I suspect that other measures will probably be brought into play to try to make sure that this disease does not spread further.
Okay.
But so far, in my opinion, so good. And we have learned good lessons. We are still at a point where we can slow down this process. So I'm just I know that probably people are still thinking the same way. Those who sit on the in the boardroom and make decisions, they are probably looking at it this way. But let me just bring you back to what you're asking me about KEMRI.
Yes.
Let me tell you one of the things that there is about this virus. Because it was a new virus, there were no diagnostics for it, all right? There were no tests. And the world is a very interesting place. When there is such a major problem, solutions are brought in so quickly, you are surprised. And there are very many tests that have now come into play that are out there from all over the world, from Asia, from Europe, from the United States, tests that are, some of which are probably useful in the diagnosis of this infection. What we are doing in KEMRI is that we are validating them. We are checking which one works, which one doesn't work, which one is cheap, which one is expensive, which one is easy to use, which one is so complicated that you can't scale it down to in the small health facility. We are looking at all these things, and there are so many of them.
So many. Yeah. And that's your work at the end of the day. Yeah. All right, let's speak to Chris. Chris is calling us from Thika. Chris, good evening. What's your question and to who?
Evening to. My question is one.
Yes.
Nauliza daktari swali moja. Namuuliza anaweza saidia namna gani, ama anaweza eleza wale wa mama wazee, wale watu hawajasoma wanaweza fanya nini kuprotect hii ugonjwa? Kuna wenye wajui mambo ya sanitizer, kuvaa mask and everything. Anaweza wasaidia namna gani, ama anaweza wa advise wafanye nini?
All right. The right question from Chris. I think it's a noble question. We did a story yesterday from Cheshire Home of the Elderly, and those are some of the concerns they had. Daktari, we begin with you.
Thank you very much. I don't know whether we speak Kiswahili because he asked the question in Kiswahili. Do we speak in Kiswahili? Okay. Asante sana. Hilo ni swali nzuri, na katika wakati wa janga kama hili, kitu cha kwanza ni kuelimisha watu mpaka waelewe ni nini, na sio wazee peke yao. Nilikuwa kwa kiwanja cha ndege on Sunday, na nilienda hapo nikakuta mama wawili ambao ni wafanyikazi wa airport wamejifunika na leso moja na wamelaliana, wameweka kichwa kando ya mwingine, wamekaa namna hivyo. Sasa mimi nikaona hawaelewi. Nikawauliza, mmesikia mambo ya corona? Na waliniambia sisi tumeoga mikono na tumesanitize. Sasa niliwaeleza hata kama mmefanya hivyo, mnaambukizana kama kuna mmoja wenu ambaye yuko na ugonjwa, kwa sababu ugonjwa unatoka kwa mapua na mdomo. Kwa hivyo sio wazee peke yao, tunahitaji kuelimisha kila mtu, na tutumie mbinu zote ambazo tuko nazo. Kama ni pale watu haelewi kizungu, basi tuwaelimishe kwa lugha ile wanaelewa. Okay. Kwa hivyo ningesema kwa Chris, tafadhali hao wazee umeona, waelezee kwa lugha ile unaweza, na tuulize serikali iweze kutumia system yake kuelezea kila mtu.
Okay, I think we talked about that last week, Chris. We also spoke about it, use of influencers in the society,
Correct.
teachers, churches, and all that. And this is very important question. I know you want to respond.
Yeah.
Respond, then I can ask you Merab's question.
The information they need to have is first, kuosha mikono kwa sabuni na maji. They must do that. Na ya pili ni social distancing. Kaa mbali na mwenzako. Kaa mbali na mwenzako. Yale mengine ni lazima labda serikali na wale social influencers and so on wapatiane mambo, waseme mambo ambayo yanaweza saidia watu mengine, lakini haya mawili, kuosha mikono kwa ukitumia sabuni na maji na kukaa mbali na mwenzako ndio msiambukizane. Hayo ni mambo ambayo ni muhimu sana.
And it's nothing difficult. It's traditional practice to wash your hands. It's just that it's a little different right now because you really need to kill the virus.
Mara mengi. Osha mikono mara
all the time.
Mengi.
All the time.
But I would like to add something here,
yes.
Ken. We also have the societal organizations. Like we have in my village, we have 3 villages which have one organization called Karinga Massive Development Organization, and it's based at the village. And there are other grassroots organizations. I would like to call upon these organizations to their leadership or people they have appointed as influencers of the community to really understand the government guidelines and then educate the people and monitor the compliance. We need, all of us need to do it, and this is not the government's activity alone. It is for the safety and conservation of mankind. So we all need to do it.
It falls on everyone's
and
shoulder.
we need to sacrifice at some point.
Okay.
Thank you.
Prof,
yes.
One of my colleagues here, and she does a lot of health stories, Elizabeth Merab. It's been a concern to a lot of people. Just what going around now that COVID could be airborne and could be last on air for quite a long time, probably 8 hours. How true is this? Is this one of those myths? And
at face value, it appears true. There is some evidence coming around to that effect, but these are still early days. This is a new virus. Initially, we thought it was just droplets that would fall down quickly, and then they would contaminate surfaces for some days, and then that would be that. But there's some evidence coming around that it's probably airborne also and stays in the air for some time. People are doing research in this area, all right? But it will be nice for you to realize how dangerous that kind of thing is and take appropriate measures.
Yes.
This is not a virus you just want to assume. Don't be surprised if we eventually declare without fear of contradiction that it's airborne. Right now, we are maybe. There's some evidence coming around, yeah.
Maybe. All right, gentlemen, this is Joe Mutugi from Twitter. This is a question, or rather it's a statement that perhaps I'd want to get your reaction. It says, Kenya can learn a bit from Ghana concerning quarantine. Not perfect, but they affected it without much drama. Government is cutting quarantine costs and it has bore some fruit. 26 cases confirmed from the quarantine. Kenyans should listen to science carefully.
Yeah, I come from the diagnostic, infectious disease diagnosis and so on. I rather like the inconvenience of quarantine, but I rather like the quarantine. Mm-hmm. It's a very inconvenient thing. Like I myself, if I came in through the airport and then they took me to some government facility with a hard bed and so on, I would probably try to fix the system so that I could get out. But let me tell you,
yes,
this quarantine is going to identify some people who would otherwise have gone into the community and caused havoc. Right? This quarantine is going to help people like myself in the diagnostic space to offer those services to people in quarantine so that if they test negative for a period of time, they go away. They go home and they are confident that for that moment, they are okay. This is what it's going to do. It's going to protect the society.
And this is something that you've also mentioned. So I'll ask you, Professor. George Mahugu is asking, why do we have the acute shortage of sanitizer and surgical spirit? Panic buying first. People just went to the supermarket. Just the other day, George, the government announced that the ethanol that had been intercepted, illegal ethanol will be taken to, I think, KPA or KPC. They'll be made into the sanitizer. But he's asking, Why don't our government provide masks and sanitizers to the population, especially where and in those counties seem to have few patients? Why don't the government zone in those areas that seem to be hotspots? I think you mentioned about this.
The truth of the matter is that there are many places that have been provided sanitizers all over the country. Even if you go to airports, you'll find sanitizers in all over sorts of places. Yes. However, the question is legitimate. Why are they not there now? This is a demand-driven market, all right? Initially, like Kemri, I can speak about Kemri a little bit because I understand how the system works there. Initially, Kemri was making sanitizers depending on demand, all right? And then suddenly, there was a massive demand. And Kemri struggled to scale up its sanitizer production. Now it's at a very high level of production at the moment, all right? And but what people did is that instead of ordering just a few sanitizers you need, people are ordering hundreds of sanitizers.
Okay, that was the problem.
So for you to adjust to that market takes a bit of time, but I think Kemri is currently on top of things.
All right, you want to weigh in, Doctor?
We need also to look at the kind of, we need to understand the kind of disaster we are in as a people. There are two main kind of disasters which can cause you to buy and stockpile. One disaster is an invasion, where you are invaded and you find that you cannot actually venture outside. In that case, you are required to stockpile, buy in quantities until the government takes care of the invasion. Now, when you have a pandemic, it is not advisable to do panic buying, because what you do is you clear the stocks and you don't give the production system to replenish. So we advise that in pandemics, just buy a little more than what you normally buy, so that everybody can get a certain amount of supplies. Like let's say you start with a week's supply. I had somebody has a 3-month supply. By the way, by the time you are taking that 3-month supply, you might even die of aflatoxin while you're trying to run away from the corona. So as a pandemic planner, a response planner, I would advise people to buy in moderation and give the production system the time to produce and replenish. Then we can all be going and buying maybe a week supplies or 2-week supplies, but not stockpiling months of supplies.
Okay, I think there was something that was trending that is very interesting. If you buy a sanitizer, the 500 ml, the small one, you buy it probably for $4. If you want to buy 2 of them, now you buy them at $95, you know. So that's just to discourage. I know you want to comment and we're running out of time, but even as you comment, this is something that someone is asking. Please ask the doctor from Kemri. Explain the ratio of making sanitizer, surgical and glycerin, cause I have been buying without knowing. I don't know what he means, but probably the composition of the sanitizer is what he wants to know.
Yeah.
Probably.
Yeah. Probably that person could even benefit from just washing their hands with soap and water. However,
and it's any soap.
I'll answer that question, but let me tell you what people did about masks. The people who needed masks were the people who are infected, or the doctors who are treating them, or the relatives who are taking care of them. And then people who are perfectly healthy went and bought all the masks, and then they thought they were protected. This is now how society gets things wrong. After taking the masks, they were still touching their faces, and the people who needed the masks were not having them. Coming to this question of the sanitizer, how to make it at home. If you check on the internet, you'll find some literature, but basically you could take something like 70%, like ethanol, alcohol, ethanol, and then you could put something like glycerin to top it up to 100%, so that at least when you put it in the hands, it doesn't dry your hands and stuff like that. Okay. So 70% ethanol, you put about 70% of that, and then you add.
You just talk glycerin.
Yeah.
Okay,
Yeah.
and your hands won't be so dry.
Yeah.
Dr. we are running out of time, but this is a question for you. You should perhaps talk briefly about the stigma, and perhaps you don't speak for the government. You said that, but how perhaps in disaster response we'll be ready to talk about or deal with stigma that would be associated with COVID-19.
Okay, thank you very much. As we speak, I have one person, our daughter is under quarantine. She came from South Africa and she's under quarantine at home. Now, quarantine and also disease, where people perceive the disease to have come from, they are considered, the way we have been doing, we have been free, and people consider these to be stigmatizing. I've also heard of cases in Makueni where somebody went and was told, please go back to Nairobi. What we need to know is that this disease is likely to affect a lot of people. That is one. Two, nobody asked for the disease. You just found the disease coming to you or coming to the population. So it is important that we take the precautionary measures as given in the guidelines and treat our people with compassion. Even if a person is sick, treat them with compassion and call in the medical staff according to the guidelines that have been given to come and take care of them, but do not stigmatize people, because the disease will be there, is there with us.
Okay.
At the beginning, health workers were also scared of, for instance, dealing with the patient or taking the sample
like
from the
I had
patient.
a story of a hospital where someone walked in with the symptoms, coughing and sneezing.
And then they realized,
took off.
Yes, it's because at that time there was insufficient information.
Yes.
Now it's beginning to change. It's just because you have coronavirus, people are not likely to attack you anymore in the streets. Within a week, a lot of information has flowed. But the lack of information is probably a big issue in the rural areas, and this needs to be addressed.
Okay, lack of information.
Now,
all right.
Okay.
I want to give you. I'll give you an opportunity to close. I've taken almost an hour and a half of your time here, but you know you're professionals, and this usually happens with the politicians. But I brought in a cartoon for you also, so that you comment about it. So this is our cartoon of the week. All right, you can see that cartoon. If you could just put it closely, even right here, but you can see it clearly, all of you, right? You can see it clearly. So let me begin with Daktari. Your interpretation of that cartoon.
In my view, that cartoon is giving the wrong image. That it is the people who are well endowed in terms of wealth and probably travel, and they have luxury, that are getting the disease. It would be better to have a cartoon that talks about everybody. Everybody gets affected.
So you think this is a little bit discriminatory when we defy the Ministry of Health directives on COVID? So you're living and all right, Prof.
This cartoon reminds me of a person who thinks he has everything going for him. He's not quarantined himself, or he's just going around his normal business thinking he has everything going for him, and yet he's the person who should be staying at home because he's carrying coronavirus and is going to give it to others.
Okay.
Yeah.
So how because the cartoon is supposed to show that something to the society. In a nutshell, the communication from that cartoon to the society.
Well, it could also be saying that, look, whether you are, even if you are well endowed, you are not immune. That is something else that it could be saying.
All right.
Yeah.
Okay, gentlemen, I'll give you an opportunity to close, but this is something that happened in 2015, and it just came to the fore the other day, and now people are sharing it all over social media. So this is Bill Gates. Let's listen to him.
So next time we might not be so lucky. You can have a virus where people feel well enough while they're infectious that they get on a plane or they go to a market. The source of the virus could be a natural epidemic like Ebola, or it could be bioterrorism. And so there are things that would literally make things 1,000 times worse. In fact, let's look at a model of a virus spread through the air like the Spanish flu back in 1918. So here's what would happen. It would spread throughout the world very, very quickly. And you can see there's over 30 million people die from that epidemic. So this is a serious problem. We should be concerned. But in fact, we can build a really good response system. We have the benefits of all the science and technology that we talk about here. We've got cell phones to get information from the public and get information out to them. We have satellite maps where we can see where people are and where they're moving. We have advances in biology that should dramatically change the turnaround time to look at a pathogen and be able to make drugs and vaccines that fit for that pathogen. So we can have tools, but those tools need to be put into an overall global health system, and we need preparedness.
All right, Prophet Daktari, that's something that happened in 2015 and now it's being shared, and perhaps he's saying we shouldn't have been more aware. We should have been more aware, and perhaps we would have put steps in place. But in a nutshell, I'll give you an opportunity now to close. And because I was speaking to Daktari, I'm just looking for a question, but even as I allow you to give you closing remarks on this.
Okay, thank you very much, Ken. Now, we have certain things that we should look at improving moving forward. As I said, we need all the key agencies that are key to this pandemic response coming into good coordination. For the people that, for the Ministry of Agriculture, it is good to advise the people who are going up country and the people who have space to grow foods that will mature in 90 days. We know them, the cabbages, the vegetables. And at the same time, ensure that they grow a variety of foods, because if this is done, these foods can also be harvested before they mature. Like pumpkins, you can start harvesting leaves in about 3 weeks. And that one will reduce the pressure on the processed food and the food in the supply chain. Thank you.
Right, very good indeed. But even if before you respond, I don't know if you can both weigh into this, or you will weigh into this, Prof. Njoroge Jr. from Elbagon, this is very important, that's why I have to read it. Now he says he met ladies in the village, old women in the village, who cannot even afford soap. It's possible there are people who cannot afford soap in this country, washing their hands with ash.
Very good.
Yes, is this an effective way also?
Very good. Very good. Wash your hands with whatever. You understand? Luckily, at this point, using just even mathematical modeling, those ladies are not likely to have come across coronavirus so far, right? Mm-hmm. Let them keep those habits. Just wash your hands frequently with whatever they have. You're not going to force them to have soap that they don't have. They don't have sanitizer, all right? But my message is actually just a summary of what it is that we have said. The first thing Kenyans need to be aware, please stay at home. You've been told to stay at home, stay there. Protect other people. Wash your hands with soap and water. Wash your hands, sanitize your hands if you can afford it and you have it. Keep distance, stay away from other people. Okay? Stay away from other people, social distancing, so that you can give people time to get the health system right and to get advances in place, to get vaccines and to get treatment working. Okay? Give the health workers time. In future, we have learned a lot of lessons from the past, not just from this coronavirus, but from Ebola and from other diseases, right? From SARS, coronavirus 1. In future, we'll probably be able to predict these things before they happen, and we'll probably be able to prevent them, or if they do happen, we'll be able to act very swiftly. The lessons learned right now, that are getting learned right now, are not going to just go to waste. Thank you.
Very interesting. I said I'm letting you go. As a disaster preparedness expert, I won't let you go. Mwema Wambua, Jackson, forgive me. How do preemptive measures against coronavirus, such as quarantine and self-isolation, work in conflict zones and refugee camps? That's so many questions.
That's a very interesting question.
Yeah.
Fortunately, we don't have a lot of those areas, and they are mapped out. Now, this is in such areas, you need to really have very tight security, in addition to all the other aspects, because the preventive measures will be the same wherever it is. Now, these people, their problem is the security situation. And that is why I mentioned that the Ministry of Interior, which deals with civilian security, must come in and map out its area of operation and what is the strength of the effort it has to put in different areas. So we need to have the plans by the different agencies, and particularly in that situation, we need to have the Ministry of Interior, that's the police and all the other agencies in that ministry, working very hard to ensure security in those areas. We also need to involve the agencies, that's the NGOs, the community agencies, that is grassroots NGOs, and CBOs. We need to involve them very strongly.
The virus hits
before the virus hits them.
Because if it does, it's a disaster. Thank you, Prof. And thank you, Dr. for coming and sharing your perspectives. And even as we do the last part of the show, this is a tweet that I think will summarize what you have all said. If, Jackson, you could just take this, because it's very important. Wankio Nyainde says the asymptomatic nature of COVID-19 in some patients make it challenging to contain the spread. Social distancing is the way to go. Please comply. I think it summarizes everything.
An active disease search. You have to go, the government has to go out there and look for infected people, whether they are symptomatic or asymptomatic.
Exactly.
Yes.
Thank you.
Well said. And it has been 4 months and 6 days since the first case of the coronavirus was reported worldwide. In Kenya, it has been exactly 12 days today, 12th to 24th. And 25 positive cases have been reported. Here is a quick look now at the global timeline of what happened since then. We begin with this. The earliest case reported was on the 17th of November 2019. On the 11th of January, China announced first death. 19 days later, the World Health Organization declared the coronavirus a global health emergency. 8 days earlier, before the 19th, that's on 11th, the World Health Organization gave the coronavirus a proper name to COVID-19. And on the 11th March, the World Health Organization yet again upscaled the virus by declaring it a world pandemic. Now to cases reported outside. We begin with China. But 13th June, the first case outside China, that's in Thailand, was reported. On the 7th, France reported the first case in Europe. And on the 14th February, Egypt recorded first case in Africa. And on the 13th, Kenya, of course, reported its first case in East Africa. Looking at Kenya's situation right now, on the 13th of March, the first case was announced right here in the country. On the 15th, and 2 cases confirmed. 2 days later, on the 17th of March, the 4th case was reported. On the 18th, 3 more cases were announced. 4 days later, 8 additional cases were confirmed. On the 23rd of March, 1 case was reported right here in the country, and today, 9 cases were reported, bringing the total to 25 in just 12 days since the first case was reported. And of course, patient 0 walked through the Jomo Kenyatta International Airport, and that's a good place to end our show tonight. The rest are the countries. We want to show you the countries that this has been reported, but we don't have them. Thank you very much for watching Sidebar tonight, and special thanks to our guest today, Professor Mwao, and of course Dr. Joseph Mugashi, for coming and sharing your perspectives with us. And because of social distancing and the fact that we don't want to flout the government rules, Sidebar is going on a break until this is contained and we are able to have experts in studio who we can sit close enough to make these discussions. But don't forget, NTV is still live every single day with our broadcasts, and we'll be able to give you as much information as you need. But we'll not have Sidebar next week on Tuesday because we have to keep this and keep everyone safe, including us. Have a good night and see you when we can. God bless and take care of yourself.